Please tell us your name and specialty. Professor Miles Prince. I'm a haematologist.
I'm Associate Professor Andrew Metz. I'm a gastroenterologist and therapeutic endoscopist.
My name is Nathan Lorenchuk. I'm a urologist.
My name is Chantal Thornton and I'm a specialist breast cancer surgeon.
What drew you into cancer treatment?
Growing up, I was aware that there were many female relatives in my family with breast cancer, and I saw a favourite aunt die at a young age of breast cancer who lived in a rural community, and I wanted to make a difference to the lives of women that are dealing with breast cancer.
What I found was that it was about a journey. Seeing patients diagnosed, looking after them, getting back to their family, getting back to life.
It's wonderful to tell patients that they no longer have cancer. That's probably the best time we have.
When people find out what you do, what's the most common question you get asked?
Mainly they ask who is going to do the surgery. People are not expecting females to be surgeons.
Well, I'm often asked if we treat women. Urology is often associated as a men's health specialty, but of course a lot of what we do involves the treatment of women.
What is haematology? And the answer is it's about blood. For me, it's about looking after patients with blood cancers, leukemia, lymphoma and myeloma.
Is there one thing about your specialty that you think people would be surprised to hear?
Most people are surprised to hear that most prostate cancer that's diagnosed in Australia these days is actually monitored and watched closely rather than having aggressive treatment.
I think that people would be surprised to know that most people that present with breast lumps or breast symptoms do not have breast cancer.
Most people don't even know where the pancreas is, despite the fact that it's predicted to be the second biggest cancer killer in Australia by 2030. Only 4% of research funding goes that way.
What drew you to Epworth?
Epworth is a can-do type of place.
Epworth is about innovation.
I find that at Epworth, if you have a good idea and bring it to the executive, people go out of their way to really try and make this happen.
Epworth is giving me huge opportunities, not just to treat patients with the most advanced equipment, but also the opportunity to start a research centre for prostate cancer patients.
How do you tell a patient they have cancer, and how difficult is that?
It's extremely difficult to tell someone that they have cancer. It's usually the worst day of their life.
I'm always honest. I'll sit down with a patient as soon as we have a diagnosis and go right through the entire story.
Honestly and with compassion.
What we found, what we need to do next, and what we can do about it, and also the likely outcomes.
They will often hear the word cancer and then they will hear absolutely nothing afterwards.
I always say, you're going to forget half of what I'm saying today. I want you to go home, I want you to talk to family, and I want you to write down a whole lot of questions and come back and see me again, because patients really do go into a blur after a diagnosis like that. I think it's really important to follow up.
For me, it's not just about telling them what the diagnosis is, but also giving them a pathway forward and giving them hope.
What's changed in the treatment and survival rates in the last 20 years?
Well, sadly, in the realm of pancreatic cancer, very little. And when you compare this to other cancers that have really come ahead in leaps and bounds, it's a fairly depressing story. It is also exciting because for me, I feel like there is now energy and a quorum of interest around pancreatic research. And I really do feel like over the next decade or two, we have the potential to make some really big gains.
We've learned enormous things about what causes cancer, and because we can take blood out of the body and analyse it, understanding blood cancers in particular has really paved the way to our understanding about a whole lot of cancers. There are some cancers that are extremely curable.
Breast cancer is a cancer with great survival rates. And so now for all comers, the survival rates are in the order of about 92%.
We're also keeping patients with cancer alive a lot longer without necessarily curing them. So if we can't cure patients, our desire is to keep patients living for as long as they can with as good quality life as they can.
What types of treatment options are available for your patients?
Well, certainly at Epworth, we have all treatment options available.
We talk to them about surgery, we talk to them about radiation treatment, we talk to them about chemotherapy, and we also talk to them about immune-based therapy, and more recently, what's called targeted therapy. Targeted therapy is about matching the right drug with the patient's particular disease and trying to make those cancer cells die by switching them off.
Are there new treatments available at Epworth that aren't yet widely across Australia?
Right now we have 20 plus clinical trials for patients with different forms of blood cancers. So in some ways, they're getting access to a treatment that may not be available for 2, 5 or 10 years later.
In the field of urology, the one thing that stands out that is available at Epworth is focal therapy for prostate cancer using a very specialised instrument called the nanoknife.
The nanoknife, destroying cells at surgery, as well as Oncosil actually implanting radiation treatments directly into the tumour, and with the potential to downstage and improve outcomes and even get these patients to surgery. And that's not widely available anywhere else in Australia.
What's been the most recent advancement in treatment?
I think the most recent advancement in treatment would be what we term multidisciplinary care. What that means is that we are able to bring together specialists from a variety of areas to treat one patient.
Probably the thing that excites me most in blood cancer treatments is the recognition of how the immune system can be manipulated to kill cancers. It can cure leukemias and it can cure lymphomas. This treatment that was a dream 5 years ago is now here to stay.
Looking at research that's underway, how do you see treatment could change in the future?
Treatment will change with more minimally invasive surgery from a surgical perspective.
I would be hoping that in the future we would be able to treat breast cancer with medication alone.
I think what we're going to see less and less chemotherapy used. What we'll see is more immune therapies where we're manipulating the patient's immune system.
What are the things that people should avoid to lower their risk?
The first thing they should do is quit smoking if they smoke. In terms of prostate cancer, we have an expression that what's good for the heart is good for the prostate.
Increase your exercise capacity, increase your fresh fruit and vegetable intake, reduce your alcohol intake.
What are some of the embarrassing things that patients are too afraid to ask?
They want to know, for example, if their penis length is normal or if having an inability to get an erection is normal for their age.
Working with pancreas and bowel, almost every question that patients can think of is too embarrassing to ask. And I have to tell them that, look, this is what I talk about all day. There's nothing that you can possibly ask me that I haven't heard before.
What's the most important thing you want anyone watching this to know?
Breast cancer is not a death sentence, and most women that are diagnosed with breast cancer will live very long and fruitful lives. Secondly, that if you've got a breast lump, make sure it's investigated, even if the imaging is totally normal. Thirdly, if you're over the age of 40, go for regular breast screening.
We certainly know that the fecal cord blood screening program saves lives, but only 40% of Australians do it. We've all got to go to the toilet each day, but this time it might save your life.
I think the most important thing I want people to know when they watch this is that there's a team behind them looking after them and helping them through their journey with their blood cancer.
What's the one piece of advice you would give someone who has cancer?
Cancer is, in most instances, particularly in our field, not a death sentence.
It's a scary word, but once you've heard it, once you know about it, once you've mapped out that journey, you can get through it.
I would say to them, never give up hope, because today people live with cancer, they don't die with cancer.